So this dog's had a soft tissue sarcoma excision from the front of his knee here. We were able to get surgical margins on that, which is fantastic. We've been treating the wound bed. You can see it's granulating quite nicely. We're going to reconstruct it today with a skin flap based on the caudal superficial epigastric artery, what's called axial pattern flap. So this piece of tissue is going to rotate round and cover the deficit on his knee.
When it comes to cancer, cancer can range from very simple to very, very complicated, just like humans. But at Southern Animal Health, cancer, especially advanced cancer or more severe cancer, is one of our main areas of expertise. To highlight how complicated cancer can be, and most importantly, the best way to go about it, we're going to use Buddy's case today. Buddy is an 11-year-old greyhound cross that was sent to us for a second opinion from a clinic that was concerned that this cancer might be quite nasty and was going to do an initial just basic surgery, which many vets do, which is just remove the cancer straight away with what margin we can and see if we can or can't close the skin after that. Buddy's situation was difficult because he had a very large cancer, about 15 centimetres, coming from the inside of his left knee. The problem with that is, if we take a big margin around that, where it sits over the stifle, the chances of closing the skin is impossible. We're going to have a really large wound. So, can we actually just take a small margin? Had the first surgeon just taken a small margin, they could have largely closed the wound, maybe had a little bit of an open wound left over that we could deal with. But would that be good enough to cure the cancer, if it was a cancer, and depending on what sort of cancer it was and how severe it was? So, when it comes to potential cancer in tricky areas, knowing what it is gives us a real chance to understand what options we have before we remove it. We're going to use soft tissue sarcoma as an example. This is a very common cancer in dogs that we see, and veterinarians with a degree of expertise can often just do what we call a fine needle aspirate in a consultation on the spot, have a look under the microscope, see if there are cells that are suspicious of that, and then that gives us a good idea to know which way to go next. When we saw Buddy, we did this and we were concerned that this cancer or mass that we don't quite know yet whether it's a cancer or not, but from our aspirate we were concerned that this might be consistent with the soft tissue sarcoma. Now, to highlight the difficulty of knowing what to do with these, we're going to talk about the grades of soft tissue sarcoma. They basically come in three grades. Grade 1, which is relatively benign but still may spread elsewhere or come back if we remove it with just a small margin. Grade 2, which is an intermediate malignancy of which we need to take quite a wide margin around the mass if we have the best chance of curing that cancer. Or grade 3, which is quite aggressive, and given where it was on the knee, we'll probably have to look at actually amputating the leg to get the best chance of curing that. So what do we do when we're first presented with these? If we just remove this cancer with a minor margin so we can get rid of it, if we're lucky and it comes back as a grade 1, that might be okay. But if it's a grade 2 or a grade 3, cutting into microscopic cells that surround the cancer induces those cells to grow more aggressively, and the cancer tends to come back far more aggressively and far more quickly than had we just left the tumour alone and given the dog what time they had left. So, to determine what sort of cancer it was, confirm what it was and what grade it was, we said to this owner, we could just take the tumour off and take a bit of a punt and have a bit of a guess, but ideally we take a biopsy first to see exactly what it is. The downside is 2 surgeries and a little bit of cost, but the upside is much, much better planning to potentially cure this. And Buddy's owner, being dedicated, wanted to do the best thing possible to give him the very best chance. So we went to biopsy and the cancer came back as a soft tissue sarcoma, as we suspected, and it was unfortunately a grade 2. So that means, had we just done an initial basic surgery with a minimal margin, it most likely would not have been good enough and the cancer will return more aggressively than before and would have a much worse situation. However, given it wasn't a grade 3, we didn't need to contemplate removing the leg as the best chance. The option we had was a very wide excision saving the leg, but the problem we had with a very wide excision of this sort of a cancer, right over the stifle or the knee, we're going to have a very large wound that you simply can't close. Now from that there's a few options. One thing we always say is better to deal with a wound than a cancer. A wound might kill your dog, but the cancer will kill your dog. However, the other option, rather than leaving an open wound that could take 6 months plus to heal, is to do what we call an axial rotation skin flap. Not many surgeons do these, but our head surgeon, Dr. Karen Davids, who's really experienced in cancer and skin flap reconstruction, that's an option she does quite commonly. So we spoke to the owner about all these options. The owner was very keen to do that, to get rid of the cancer. We started with the first surgery, and you can see in some of our pictures here, you can see with the first surgery that when we take it with a wide margin, we've got a really large open wound. Now, although we could go straight to a reconstructive surgery, one thing we need to make sure of when we remove that cancer is that we do actually have a clear margin. You never know that for sure until pathology comes back and the pathologist actually checks that we have a clear margin. So while we have to wait for a week or so for pathology to come back, we bandaged and redressed this wound every few days looking after it, hoping that we come back with a clear margin. It did fortunately come back with a clear margin, so we were ready to proceed with rotational skin flap. In the following videos, you can see Dr. Karen at work doing the rotational skin flap to give Buddy the best chance of saving his leg and being fully healed as soon as possible.